Hi, I'm Dr. Ochiai, and I'm going to give you some physical exam things that I would like you to do when you schedule your appointment by telehealth with me. Unfortunately, with telehealth, I can't do a physical exam where I'm touching you because we're separated by a great distance, but this is going to be something where I can have you do it while I look at you, and that's going to give me some additional information to make your visit more productive. So the first thing we're going to do is I just want to see if you can set up your screen so I can see you walk. So just kind of walk like nobody's watching you, okay? So I don't want you trying to walk like you're walking perfectly. I want you to walk like you're comfortable. So that's the first thing I'm going to have you do. The second thing I'm going to have you do is something called a twist test. Okay, so normally people are seeing me for a hip condition. So what we're going to be doing is we're going to have you bend your knees to 30 degrees. So 90 degrees is sitting in a chair. So just to 30 degrees, and I want you windshield wipering your knees back and forth. You see how it looks like a windshield wiper? So that's the first part, okay? And then we're going to pretend like my left hip is hurting. So we're going to have you lift that left leg up and hold gently with your fingertips onto something so you don't fall. Bend to 30 degrees and do it on your non-affected hip. Then I want you to, again, hold on to something and then do it on your affected hip, okay? So that's called the twist test, so we're gonna be looking at that. If possible, if there's somebody with you, then lay either on the floor or on a cot or something like that, and have you lay back, and I'm going to have you do abduction on both sides. So this is abduction on my left hip, this is abduction on my right hip. So I'm going to want to check between those two sides. And then this is hip flexion here, and this is hip flexion here. And I want you to do that until it starts to hurt you. Don't try to force it past where it hurts you. The next test is going to be something called an iliopsoas stretch test. So again, we're going to pretend like my left hip is the one that's bothering me. I'm going to bend both my legs up to put my hips and my knees up to my chest. And then I'm going to grab onto the other leg and slowly put it to the floor. And then we're going to test that on both sides. The last thing I'd like you to do is called a seated Faber test. So we're going to have you sit at the edge of a chair or at the edge of your bed, and then we're going to do right hip seated Faber, which is doing this, and then we're going to do left hip seated Faber, which is doing that. And then the last thing I'd like you to do is that if you can, if you can't, just don't do it, but put your fingers together, put your feet shoulder width apart or a little bit farther than shoulder width apart, and toes pointed slightly outward, and I want you to do a goblet squat, coming down like this and up. So coming down so that your elbows touch your thighs and coming up. Thank you.